Smith, I'd like to remind you of the previous display.
Yes.
Could you introduce yourself to the jury for us?
My name is Dr. Avery Smith.
Now, why are you here, Dr. Smith?
I'm here to talk about the BRAC test that I performed on Danny Dawson the night of the accident.
You have to forgive me, Doctor. I don't know what a BRAC test is. Could you tell us what that is exactly?
Of course. BRAC stands for breath alcohol content. It's what we use to test how much alcohol is in someone's system.
Now, we'll get to talking about that test in just a little bit. But I'd like to get to know you a little better first. Where'd you go to school?
I got my undergraduate from Gonzaga in biochemistry. After that, I then got my master's and PhD from the University of Washington in biostatistics.
You know, I'd like to get back to that BRAC test. What does it stand for again? I'm sorry, I forgot.
Breath alcohol content.
Now, how do you measure breath alcohol content?
Well, here in the state of Midlands, we use a machine called the Intoxilizer 8000.
Now, how are you qualified to operate an Intoxilizer 8000?
Well, I actually have 5 different qualifications on that specific machine. I'm an operator, a supervisor, instructor, technician, and I can perform the tests.
How exactly does an Intoxilizer 8000 work?
Well, the general science of it is somebody blows into the machine, and then it measures the amount of alcohol in that person's breath using infrared light.
Now, I'd like to talk about the process you go through when administering a breath alcohol content test.
Of course.
What's the first thing you do?
Well, the first thing that we would do is we would check the machine to make sure that it's working correctly. It does most of the work for us, so we want to make sure that that is in proper working condition.
How do you make sure that machine is in proper working condition?
Well, there are a few things that we have to check usually. The first thing being the mouthpiece. We want to make sure that it's clear of any debris from the previous uses. So once we wipe it clean, we can move on to the next step.
Dr. Smith, if for some reason you hadn't cleaned that mouthpiece and checked it for debris, what would happen?
Well, if there was still leftover breath from the previous user, that could have been registered on the machine and cause a misread.
Now, after you check that mouthpiece, what's the next thing you do?
Next, I check the simulator solution, which I just made a few hours before Danny Dawson came into the station. That's why I was there so late.
Sorry, Doctor, you're getting over my head. What exactly is the simulator solution for?
The simulator solution is what the machine uses to make sure that it's working properly. It's kind of like a self-check on itself. The solution is kept at 0.08, which is the legal limit here in Midlands, so that when the machine tests it, it can know if it's registering alcohol content correctly.
Now, after you've checked the mouthpiece and made sure that the machine is registering alcohol content correctly, what's the next step?
Well, the next step would be to run the diagnostic on the machine, make sure that it doesn't give us an error message, then we would have the subject run the test.
How would a subject run the test?
Well, it's simple actually. All we need is the subject to give us 2 samples of their breath.
Now, do you have to ask the subject any kind of questions, or do you have to interview them before they give that breath sample?
Of course. Right before they give their 2 samples, we want to make sure that the individual's been observed for 15 minutes.
Why is it that important?
Because of residual alcohol of the mouth.
What exactly is residual alcohol in the mouth?
Residual alcohol is kind of like onion breath. After you eat an onion, if you take a bite, that aroma, that stench is still going to be there for 30 to 45 minutes after you eat. The same can be held for alcohol. After you drink alcohol, or even do things like take mouthwash, have a breath mint, there can still be residual alcohol in your mouth for a few minutes afterwards.
After you've observed someone for 15 minutes to make sure that they don't have residual alcohol in the mouth, and they blow into the Intoxilizer 8000,
Yes.
What's the next step?
Well, after that, the machine pretty much does most of the work. We'll wait around until it prints out a reading for us.
Now, Doctor, you said it prints out a reading. Where exactly do you perform breath alcohol content tests?
We perform them downtown at the Midlands Police Department headquarters.
You said at the police department headquarters. Who's in charge of observing someone for 15 minutes before they take the test?
Yes, Either I could, as the operator of the machine during the test, although a lot of times the officers on the scene will observe the individual for me while I get the machine ready, or prior to that.
Is that standard protocol?
Of course, especially since I'm the one that makes the standard protocol here in Midlands.
All right, doctor. Now, that process we were just talking about, did you use that process when you administered the BRAC test to the defendant?
Of course.
Did you have that simulator and the mouthpiece and the defendant's 2 breath samples in order to run that test correctly?
Yes, I did. The mouthpiece was wiped clean, the simulator was running correctly, and I just made it.
Did you use that standard protocol that you made?
Of course. I do it every time.
Doctor, I'd like to turn your attention to the test you ran on the defendant. Was that run at the police department headquarters?
Yes. The machines are all kept there, and that's where we tested Danny Dawson the morning of September 25th.
How's the defendant behaving when she arrived at the police station?
The defendant was slurring his words, talking kind of loudly, very deliberately it seemed. But other than that, he seemed like any other subject that I would see.
Now, who observed the defendant for 15 minutes?
Officer Foster, the arresting officer, had observed Danny Dawson for 20 minutes prior to bringing him to the station. I then observed the subject for 5 minutes while I made sure that the test was running correctly. In total, he was observed for 25 minutes.
After you observed the defendant for 25 minutes and made sure that the machine was working correctly, what was the next thing you did?
The next thing that we did is we had Danny Dawson run the tests. He gave us 2 samples of breath, and the Intoxilizer 8000 printed out a report for us.
Now, you said that a subject needs to blow 2 breath samples.
That's correct.
What was the defendant's first reading of breath alcohol content?
The first reading was 0.194.
What was the defendant's second reading for breath alcohol content?
Very close to it, 0.191.
Doctor, you mentioned observing the defendant's behavior when she arrived at the station. Is that behavior consistent with her breath alcohol content?
Yes. Slurred speech, all of those different things that I saw as an operator are consistent with somebody blowing a 0.19.
How do you know that?
Well, there's a treatise that we use in our field. It's relied upon by everyone. It's called Alcohol Consumption of the Human Body. Everyone in my field knows it, and that's where I got the data from.
Where exactly does that article come from? Where'd you get it?
It's published, and everyone in my field has access to it.
Your Honor, may I approach the witness with prosecution's exhibit 7?
You may ask for some counsel, please.
I'm just about to show it to them, Your Honor.
Okay, please show it to them first before you approach the witness.
Showing opposing counsel. Here you go, Doctor. I just handed you an article. Is that the treatise you were just telling us about?
Yes, it is. The one made by Dr. Becky Benton and Eve Carmen.
Your Honor, would you like a copy?
Has it been introduced into evidence?
Your Honor, pursuant to Midland's Rules of Evidence, federal rules of evidence, I'm not allowed to enter these exhibits and have them taken back to the jury. But if you'd like to have a copy that you can read along with the doctor, and I can get it back before you all go to deliberation, if that's all right with you, I could give you one.
Do you have any objection to this? Being talked about in this one? No, Your Honor. Okay.
May I approach?
Yes.
Your Honor, if you don't mind, could I show you all a blown-up copy?
We are the jury. So the jury is not allowed to see this document.
Your Honor, the jury isn't allowed to take the document back to the jury room for deliberation.
Okay. Okay. Yes, you may show us the posture of this.
Your Honor, may the witness step down?
Yes. And you may reposition yourself.
Doctor, please. Instead, I'd like for you to tell the jury what exactly someone with a breath alcohol content of 0.19 would be experiencing.
Yes, someone experiencing a 0.19 BAC would be in this range right here. And all of the symptoms here would apply to them. confusion, dizziness, exaggerated emotions, impaired visual perception, decreased pain sensation, impaired balance, staggering gait, slurred speech, and moderate coordination impairment.
Now, doctor, based on your career, your experience administering breath alcohol content tests, would someone be able to operate a vehicle safely with a breath alcohol content of 0.19?
Definitely not.
Doctor, do you know what the legal limit of breath alcohol content is here in Midlands?
Of course, that's what we keep our simulator solution at. It's 0.08.
Thank you, doctor. You can sit down. I'll get that from you. Pass the Sean.
All right. Will you be using the demonstrative?
No, I will not. I asked that. Okay.
I'll help you do that.
You may begin when you're ready.
Dr. Smith, you're currently the Director of Forensic Science in Midlands,
That's true.
and you're qualified to run breath alcohol concentration tests, correct?
That's correct.
In fact, here in Midlands and in Midlands Center, you use the Intoxilizer 8000 for these tests.
Of course.
And the Intoxilizer 8000 uses a blood-to-air ratio to determine VAC, doesn't it?
That's true. The blood-to-air ratio is 2100 to 1.
However, this is a standardized ratio, isn't it?
Yes, there's no real way to determine any individual's specific blood-to-alcohol ratio, so we use a standard result.
So not everyone exhibits this same ratio, do they?
It could be a little different between people.
In fact, it's quite possible that Danny Dawson doesn't have this blood-to-air ratio, isn't it?
It's definitely possible, but as an average, 2100 does fit the majority of the population.
But it might not fit Danny Dawson, isn't that right?
I did not observe Danny Dawson in a medical sense, so I cannot
Objection,
attest.
Your Honor.
Yes?
Pursuant to Rule 403, may I assume we're outside the shot of the jury?
Yes. All objections will be considered done.
Pursuant to Rule 403, this is going to mislead the jury. Opposing counsel is attempting to hold Dr. Smith, as well as the Intoxilizer 8000, a standard machine used in the medical field, to an impossible standard. Her line of questioning is trying to elicit testimony that Dr. Smith is required to go out into the entire city of Midlands and find everyone's breath-to-blood ratio. It's going to mislead the jury, and seeing that Dr. Smith's tests are incorrect in his findings, and Danny Dawson's breath alcohol content are incorrect, and I believe that's misleading the jury.
I think this goes directly to his investigation, and I think the jury can handle it.
Yes, Your Honor.
Overruled.
Now, once again, Danny Dawson might not have that exact ratio, correct?
Of course.
Now, earlier on direct examination, you mentioned that you have a standard procedure you follow. That's right, isn't
That's
it?
true.
In fact, part of this standard procedure is that you have a 15-minute observation period, right?
Yes, that's what we said before.
And during this observation period, you observe the defendant for belching.
That is one of the reasons that we have the observational period around, to make sure that the subject hasn't consumed any alcohol, mouthwash, breath mints, belched, burped, things of that nature.
So vomiting as well, you observe for vomiting.
That's true, vomiting as well.
Acid reflux.
Yes.
However, you didn't ask Danny if she had experienced any acid reflux, did you?
No, we usually don't tend to ask people right before they go on the machine if they had burped or belched, because if we did, that could prompt them to do it right before we take the test, and then the test results would have been skewed.
Burping and belching don't have to do with acid reflux, though, do they?
No.
And you didn't ask Danny if she had experienced any acid reflux, did you?
No, we usually don't ask any of those questions.
Doctor, you didn't ask if she experienced any heartburn either, did you?
No, that's correct.
However, both of these can cause residual mouth alcohol as well, can't they?
Yes, that's true.
Now, doctor, back to this 15-minute observational period. You personally didn't observe Miss Dawson for that 15 minutes, did you?
No, I observed Mr. Dawson for around 5 minutes as I was making sure that the test was properly set up. But Officer Foster, who I had talked to, said that he had observed Danny Dawson for the 20 minutes previous.
Right, you relied on Officer Foster's observations.
That's true. Officer Foster and I have worked together for a long time. He's been an officer in the field for about 10 years. I trust his testimony.
Officer Foster was driving the patrol car that Danny was in, wasn't he?
Yes, that's true.
And it's possible to burp silently, isn't it?
I would assume so.
So it's possible that Officer Foster may not have heard a burp or a belch, isn't it?
It's possible, although that's why we wait the 15 minutes, and in this case, 25 minutes, just to make sure that if an event like that had happened, the alcohol that would have been put into the mouth had time to evaporate.
Now, earlier on direct testimony, you said that someone who exhibits a .19 BAC has confusion, didn't you?
That is one of the possible side effects of having a blood alcohol level at .19.
But Danny Dawson didn't seem confused, did she?
No, he did seem a little shaken up though.
She didn't show exaggerated emotions,
No, again, though he did speak very deliberately.
and she didn't show decreased pain sensation, did she?
No, I didn't test for that though.
So you were surprised when Danny blew a .19 BAC, weren't you?
That is true. I was surprised that the result that the machine told me was so high.
Because she didn't show any of these symptoms, correct?
Because she didn't show all of them, as well as .19 is a very high PAC in and of itself.
No further questions, Your Honor.
And redirect.
No redirect, Your Honor. May I let him speak, please?
Yes. Any other witnesses for the prosecution?
No, Your Honor. This time the prosecution rests its case in chief.
All right. Do y'all want to break between the cases in chief?